Welcome to the Health Angle Podcast with Dr. Mike Headlee and Dr. Gordon Fimreite, where we'll be exploring different angles of health to achieve the best version of yourself. Now here's your hosts, Dr. Mike and Dr. Gordon.
Welcome everybody. I am Dr. Mike Headlee and with me is Dr. Gordon Fimreite. Welcome, Gordy.
Hey, Dr. Mike, and welcome everybody. Our subject today is shockwave therapy, and I personally don't have the shockwave equipment, but Dr. Mike, I know you do, and I've done my own research, and I'll share some bullet points, but I'm really curious, and I'll be asking you questions as well. But tell me your experience with the shockwave that you have in your practice.
Yeah, Gordy, the reason why I got involved with it and used it is 24 years ago I got in a car accident and hit an embankment going 70 miles an hour on the interstate. I hit a semi and hit an embankment and actually cracked a vertebrae in my lower neck, and then my right knee hit the dash of a Ford Explorer and it damaged my joint capsule, tore the labrum, and cracked the ball and socket in my right hip. And wow, that was 24 years ago, so there's wear and tear in there. I've got adjusted all that time, try to stretch and be as healthy as I can, but I go, geez, what can I do to fend off surgery as long as I can? I don't take any drugs. I don't need to get up and take an Aleve or ibuprofen or whatever that is. I put balms and creams and hot tubs and ice baths and stuff. So I looked up this shockwave therapy and I found a chiropractor 5 hours away, and I went down there and tried a session, and it was almost like I walked out of the office like I'd never had a hip issue. And it was, I don't have any cartilage in my right hip, unfortunately. And it was really, really, really exciting. But then I go, well, that's for a 10 to 20 minute treatment, depending. I go, geez, now I got to hop in the car and go 5 more hours home. And I still felt great, and for several weeks. But I go, that's just too long. So I looked into the technology, and I ended up buying something called a stem wave. And I'm my best testimonial because I got it for myself, but it worked so good on me that I wanted to use it on patients.
When did you first use this?
Probably 2 years ago.
Okay.
Now, it's been a little over 2 years. Mm-hmm. And it's really, really unique. It's kind of, I'm usually not an early adopter on technology like this, and otherwise, I'm just using my hands and chiropractic. I recommend some nutrition and other things like that, but I really needed to get that to help with inflammation. The number one thing it does is it helps reduce inflammation. And so I can get into more of my case and how I use it on myself and my other patients, but what's your experience with just talking about and learning and online? And do you have any other clients that have used it in your practice or other people? What's your
Well, I know that this has
knowledge on
just been
that?
budding and it's just becoming to fruition lately. I really haven't heard of shockwave therapy probably just in the last 2 or 3 years. Just haven't. And now you see it and it's like everywhere. But I looked it up, and I know they originally came up with shockwave therapy for kidney problems, to break up stones and etc. And then it evolved in the 1990s for actual use for neuromusculoskeletal conditions. So I didn't know much about it. One of my colleagues here in Chicago actually has the equipment. So I went in and I wanted to experience what it was like. And I happened to have a low back episode. Nothing really bad, but it just flared up. I work out a lot, and sometimes those mechanics can flare up. And so I went in and I asked her some questions how it worked, and she basically took the device and put it on my low back where I was having the issues. And for the viewers who really don't know much about shockwave therapy, what it really is it's a device. Maybe it's about 1.5 inches, 2 inches in diameter. And you basically kind of rub that around the area of where people are having problems. And what it does is it sends these acoustic shock waves to break up tissue calcifications. It also enhances the collagen synthesis, release growth hormone factors, stimulates your body's process to improve pain, and helps keep you active. There's other things too, and I'll share in just a little bit. But when I had it, I didn't really know what to expect from it, Dr. Mike. And I was trying to describe how it would feel. And to me, and you can tell me what you felt when you had it done on you, to me it felt like a combination of like ultrasound, muscle stim, probably the combination of those two, but much different. And I know some people, they'll say that it's a little uncomfortable when they have it done. Of course, when you have chronic pain and chronic problems, I mean, what's a little bit intensity as you're having it done? Kind of irrelevant because it really can make a difference. So after I had it done, it just felt like kind of a shock. I could feel the shock wave. It wasn't too intense, but it was just, I could feel it was there. But something about it really felt therapeutic. By the next day, my inflammation, the muscles splinting, spasm, pretty much diminished. So I was pretty satisfied, and I was pretty shocked. Shockwave. I was pretty shocked how well it worked.
Cool.
So yeah, I thought when you tried it for the first time, how would you describe the sensation?
I went and I used, there's two major devices. So I used a different device than I purchased, and mine was really uncomfortable. And it's kind of sounded like a ball-peen hammer hitting some metal. And it's really loud and it's really thumping, and it was really discomfort. And I really wasn't versed in to say, well, more pain. I thought more pain the better. It's grinding something out. It's helping, and we both have had dental work without Novocaine and gas and things like that. So we kind of know what pain is. And I said, I can handle anything for a few minutes and stuff if it's going to make. And then now I know, since I've used it for a couple of years, that no, more pain isn't better. And so it was really uncomfortable to have done for me. It was just like needles going in my system, and it was really loud. I've come to realize that it didn't do tissue damage. It just caused me a lot of pain, and you don't have to cause pain on a client or a patient to get really, 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 really good results. You have to have some discomfort because that's where the inflammation is. But yeah, mine was discomfort, but I didn't really care because I walked out of there like I had a brand new hip, and I drove 5 hours, and I got out and I just I don't want to move. I just feel so good. I don't want to ruin this feeling. It was just amazing.
Yeah. Now that you've had it done, though, Dr. Mike, that must make patient experiences that much higher. Because first you have a little passion, you have a little experience with it. But what are the typical patients that come in, and what kind of results have you had?
Yeah, my favorite conditions to see are any shoulder issues, hip issues, because that's what I use it on myself, is hips. I like knees, but also I really like wrists and thumbs. A good amount of people have some degeneration in their thumbs, and chiropractors as well. And so thumbs and wrists, and then the lower back and the SI joints. I'm not super thrilled on you doing too much high up in the neck, maybe the traps into the shoulders. So shoulders, hips, knees, wrists, thumb, and the SI joint, lower back. And so, for instance, I've had a lady that has bone-on-bone knees, and 65-ish, just doesn't want to get both knees replaced right now. Wants to continue her 5 mile a day walking, but she walks a mile and she feels the aches, and she doesn't like to take ibuprofen and all that. And so I just found out the goal is to find out, when you put the shock waves into the body around the knee, where the discomfort is. I shoot for a 1 to 3 pain level. 10 would be the worst. So if someone just has a mild 1 or 2 pain, that's super tolerable. But when I put the device on there and put the shock waves in there, Gordy, I know that where the inflammation is if they have discomfort there. So then it's biofeedback. So then I will go over that area and want to treat that area. But if the inside of their knee, they know there's pain, I check everywhere, the front and the back, because there might be some major inflammation on the outside in the lateral meniscus and or under the patella. And so, long story short, I always do pre and post. I'll have someone for knees. I'll have them squat. I'll have them do a lunge, usually hold on to a chair, get on the floor on their knees, and then get up and just do some functional movements, because I want to see, besides pain, I want to see how they're functioning immediately after. So I did that, and people can't stop squatting after they get their knees done. They're just like they got springs in their knees. They go, wow, I can kneel, I can squat again. And they go, wow, it's so much easier and lighter. The average person gets 5 to 20% better their first time. So if you're 20% better, and can squat and kneel and lunge and move, and the pain is gone, and they're walking up and down the hall trying to hurt their knees even though they can't feel the pain, I know their care plan can be anywhere from 6 to 8 to 10 times, and they're going to get really, really good because they got really good on their first time.
Wow.
And so, of course, we teach what we teach, anti-inflammatory, a lot of hydration, chiropractic care, stretching, all that other stuff to keep the inflammation down. But my experience in 30 years, I haven't seen anything that penetrates. The machine penetrates 10 plus centimeters. So it can go deep into a joint where just like ice and ice baths, red light therapy, ultrasound doesn't even get rid of the inflammation and heal tissues that we'll talk about in a little bit. So I know someone will get better after their first time if they have a positive functional and a feeling outcome. So it's a pretty no-brainer to get the tissues de-inflamed and start the healing process, help circulation and stimulate the stem cells to do the true healing. So real quick with that lady, I saw her 8 times total. She went away for 3 months for the winter, walked 5+ miles, went to the gym a lot on her winter vacation. She came back in the spring, was kneeling on the ground, planting garden, doing all that other stuff, and she's super thrilled. She doesn't need knee replacements, and she's
How old
very
was she, Dr. Mike?
65-ish, 60s.
Wow.
So maybe she needs knee replacements someday, but she doesn't want it 65 because she wants to live till she's 100, if possible.
I mean, that shockwave therapy just gives people hope. And I think my next practice, I am definitely 100% going to incorporate this, because we both have had patients who have symptoms that seemingly could be outside the scope. I know we can do a lot of wonderful work, but sometimes something is so chronic where that tissue has been under stress for so long that it becomes a challenge. And having this tool and this technology, I think, is wonderful. I want to share just a couple of bullet points about the shockwave therapy that I have learned and I think would be interesting. And so advanced treatment of shockwave therapy, there's another name for this. They call it extracorporeal shockwave therapy, and it's abbreviated ESWT. So if you ever hear it that way, that's basically shockwave therapy. So it's a device that's generated either radially, or it can be more penetrative, more specific, and it goes deep into the tissues. You shared that perfectly. And then it's an emission of the acoustic waves, and we just talked about that. But here's the part that I think is interesting. It breaks up soft tissue calcification, enhances collagen synthesis, releases growth factor, stimulates your body's healing processes to improve pain and help you stay active. That's key, staying active. I think everybody wants to stay active, but it's usually those little nagging injuries over time that get the most of people. So the therapy also enhances blood circulation and metabolism, and then it accelerates healing and those stubborn neuromusculoskeletal type of conditions in the bones, in the tendons, in the ligaments, also in the muscles. So there's a lot of cellular activity, increased blood flow, and then it promotes regeneration. It's a great way to at least avoid or put off the more invasive cortisone or steroid injections that people don't want. But sometimes inevitably they have to, but shockwave therapy might be a way to avoid that. Or if you have surgery, it might be a great way to delay or just indefinitely put off the surgery. I think it's a phenomenal technology. And one of the things that I read, Dr. Mike, is they say one of the negatives is sometimes there's transient pain, swelling, or bruising to the area being treated. And maybe a little redness, but I would say that's pretty minor compared to the benefits that you could possibly get. And then also, some of the patients, just like you described, being a little bit uncomfortable. And I think I experienced that too. I would classify my experience as just being a little more on the intense side. So I have 3 studies that I'm going to reference. I want to let you go ahead. Before I do that, though, Dr. Mike, when I'm doing my research, I actually looked up on the National Institute of Health more information about shockwave therapy, and I thought it was a good resource. And I'm going to share that. I'm going to put it in the comments section, and it's backed by some scientific studies showing basically proliferation, regeneration, and cell growth and collagen synthesis. So I'll share what those 3 studies are in a little bit. So what else do you have, Mike?
I saw a soccer player a couple weeks ago before the section final, sprained ankle. I mean, really gingerly walking on it and didn't. So I did what I do as a chiropractor. I checked his spine and nervous system because I want to make sure the nervous system and the circuitry going to all of his body parts is as close to 100% as possible. And I do some extremity adjusting, so I adjusted his ankle and got that in alignment. But guess what? His ankle was still swollen, and he's still had a hard time walking on it. So I used the stem wave on his ankle, and he couldn't believe how he could walk out of the office, without just tiptoeing and whatever. And so I did that twice that week, and then I think like Monday and Thursday, and then he played in the section championship on Friday, and they just happened to win. Actually, they went to state, and I mean, so that was an acute injury, and you just don't want them to take the approach. And I'm not knocking anyone else, and there's a lot of ways to do this. You can put your ankle in the ice bucket and tape it and rest it and elevate it and all that stuff. But the trainer, they just want to tape it really hard with that white athletic tape, and I go, well, I'd rather do stem wave on it and get the inflammation on it, get the alignment, get the movement, maybe use some kinesio tape type stuff so it has functional support and not have him do more damage, because I know he plays other sports in the winter. So that's just really exciting. So there is a caveat, though. You got to be careful with young athletes on the growth plates, because this puts a really intense shock wave in there, and you got younger patients. There's only a few contraindications, wounds and cancer and pacemakers and certain things like that. But growth plates, that's the only knock on younger athletes. You got to be careful not to do it on their growth plates. Another guy came in last Friday. I think he's coming in tomorrow. He can't literally open a jar because of his thumb is so degenerated, and he just doesn't know what to do. I don't know if there is surgery for that or what you do. And he takes a lot of pills. And one treatment on there, and it was a little bit more uncomfortable than, there's not a lot of padding to go around the thumb. And he can't get over, and I've done it on my thumb before too, because I've injured my thumb and had some wear and tear. It's unbelievable. Like, where did the pain go? Where did the inflammation go? And it's just really, really, really cool to work on all body parts to get the chronic inflammation out of there. Most of the time I see chronics, but I saw that high school athlete. He was done growing. He was 18, and I didn't do it directly over his tib-fib growth plate. And anyway, so yeah, I just think it's a really unique therapy. I looked up that a lot of pro teams are using this as well to help recover.
It wouldn't surprise me, because these athletes are healing so much quicker and faster from injuries that would usually take 4 to 6 weeks, and they're right back in the field after 3 weeks. So yeah, there's no doubt. If they use chiropractic, optimize the mechanics and take the stress off those injured joints, and then use shockwave therapy as well as laser therapy and other modalities, I could see that, wow, they would heal so much quicker than the average person. Dr. Mike, so do you get people coming in, they've heard about this new technology that you're using, and you get referrals from that?
Yeah, a standard approach is like a $49 intro to try out the therapy, because I really don't know how someone's going to respond. I do a functional maneuver, then we call it a mapping session. So if I'm on my shoulder and it hurts here, well, I'll put the ultrasound gel all around my shoulder and my trap, and then I will map out the shoulder and find out where all of the hot spots or the inflammatory spots are. On a scale of 1 to 3, I just do not ramp it up very high. I might, if it's a 5 or a 6, you take the machine off and it's a 0. It's not doing any tissue damage. So then I will dial down the intensity on the machine and then put it back there and say it's a 1 or 2. Great. Now I know how to therapeutically take care of that. And then I'll find out the deltoids and the rhomboids and different things like that. So I call it a mapping session, and then I see if they can raise their frozen shoulder and move it around, and then I know if they're going to be a great candidate. But I don't know until I do a mapping session, and it's a $49 introductory pretty low end way and go get a cortisone shot for a couple $1,000, and there's no guarantee with that either. So it's a pretty low entry to see if it's going to help someone. And
Yeah,
so
and some people can spend thousands of dollars just on getting the diagnostic tools like an MRI, CT scan. That could cost thousands of dollars. So in the scheme of things, trying modality such as Shockwave, $49, not a lot of money.
No. And then one last case, I saw a guy 2 weeks after he had a hip replacement and had a lot of inflammation and scar tissue and stuff, and it's totally safe to do over joints. I know a colleague of mine that does it the same day after a joint replacement to really speed up the recovery by getting rid of the inflammation and the scar tissue and help optimize circulation. So this guy felt like he still had a lot of hip pain and bursitis and soft tissue, so we worked on his hip, and he thought it was amazing. Squatting, lunging, moving, functional movement, 2 weeks after hip replacement, and he's doing great. So there isn't too many contraindications, and the sky's the limit to really get people active, like you said, and keep people moving and functioning and just feeling good, drug free.
That's great. Dr. Mike, I'm going to just share some studies, just 3 quick studies from the National Institute of Health, and just to verify that, yes, this has been studied scientifically, and there's some good research out there. So there's a controlled laboratory study, and they learned that shock waves mediate cellular growth, keyword cellular growth. They also saw a significant increase in collagen type 1 synthesis in tenocytes. Again, the keyword here is collagen synthesis, and that was compared to the control groups. Overall cell growth and protein synthesis, and therefore regenerative qualities. So that's the first study. Great information. Wheels et al. Also made remarkable contributions regarding the effects of shock waves on proliferation. Again, keyword proliferation. Further clarifying tissue regeneration. And the third study, this was Griffin Thompson. It was a study in PubMed, neuroprotection qualities in animal studies. Proliferation of the Schwann cells, which played a significant role in regeneration of nerves. They're showing that there's neuroprotection qualities, which is kind of exciting because there's a lot of people that have had problems due to injury and they lose that nerve function. And this is showing regeneration. So I think the sky is the limit for the future on this shockwave, Dr. Mike.
Yeah, Gordy, I wouldn't be walking and practicing, and I would have had a new hip if I didn't have this. And because I don't have any cartilage left in there, unfortunately. It's just bone on bone, and it grinds. And some days it's just like it pinches in there and it binds. So then I go in the room and I work on myself, and now I'm relieved. So it's really, really exciting. And I just wanted to touch base real quick, as we've talked about our cells and our cell membranes and good fats and bad fats, and our cells are kind of like a balloon. Okay, and so when my cells are puffed up red and swollen because they're inflamed, I put the head of the shock wave over there and put these acoustic shock waves in there, and that's stimulating the receptors on that balloon or that cell. It's not damaging it, but it mimics like it's creating an inflammation response. So it stimulates the cells and the tissues, what would actually happen in a sprained hip or joint. And so then that allows the blood flow and the collagen and all of the stem cells to help heal and repair the damaged tissue. And it's deer season right now. It's hunting season in northern Minnesota, and I didn't hunt this year, but I've hunted and cut up a lot of deer in my day, and we've worked on cadavers in chiropractic college. And the cartilage and the tendons and the ligaments are white tissues because they don't have a blood supply. Cartilage discs don't have a blood supply, with one exception. If they get a tear or damage to it, then blood gets in and starts the degenerative process. And so also with these tendons and ligaments and the scar tissue all around that ball and socket that's worn on me, I stimulate those cells, and I put mechanical acoustic shock waves in there to waken up that so-called dead tissue, that white tissue that doesn't have a lot of blood supply, So I wake up the tissues, create slight inflammation. I've never seen a patient bruised after I've done it, and it's really, they walk out, there's no recovery. You don't ice or heat or you take any ibuprofen. You don't have to do any recovery. And a lot of people go to the gym or go for a walk afterwards because they feel so much better. And so we wake the cells up, the water balloons up, and we get the white tissues more blood supply and circulation and stimulate those cells that have been damaged. Some of my cells are damaged, and so I'm waking them up. And so what else can you do to aliven the stem cells and to regenerate tissues better? Fasting, we've talked about fasting. Really, really good hydration, really good sleep lifestyle, basically. There's things like colostrum and spirulina that's been shown to really optimize our stem cells. But gosh, if you pair it with just a really healthy lifestyle, your body can regenerate and repair in a great way, Gordy, instead of just keep degenerating and rush to the doctor for drugs and surgeries. And so it's given me a new lease on life and really prolonged any kind of major medical intervention because I'm just not excited about that.
That's great. Mike, thanks for sharing. Great information, good explanation. I think our viewers will have a picture, and hopefully if they're having these chronic conditions that just aren't working, they can seek help. There's help out there. Find a chiropractor with good Shockwave. That's my recommendation. If you haven't already, please subscribe to our podcast, and please like our content as well as hit that notification bell. Dr. Mike, any final thoughts?
Yeah, if you want to find a referral, stemwave.com, and you can see who is certified and has a machine in your area, and then you can go try a session. Very low cost to get a session, a mapping session, to see if you're a candidate to get really, really great relief. But yeah, it's a really fun thing because there's no drugs and surgery, and we can just help people on a way. Chiropractically, I can't regenerate tissues in knees, and I can realign things, but I can't prevent degenerated joints from needing shots and pills and surgeries as well without this technology. So that's why I got it for myself and my clients. So highly recommend it, stemwave.com. And with that, I guess, what's your number one takeaway that you can maybe have a discussion with your peer group and see if anyone's heard of shockwave therapy, and see what their experience is and what a provider in your area can do? And what's your number one action step? What are you going to do to regenerate your tissues in your body? And what's your number one action step that you can take from the discussion that we had here to optimize your health and well-being?
Thanks, Dr. Mike. We're going to put our next week's episode right on the screens. We appreciate everybody, and thanks for a wonderful addition. This was awesome. I've learned a lot from you, Dr. Mike. So thanks for joining us, and we'll see you on another episode on the Health Angle Podcast.
Thank you for joining us on the Health Angle Podcast. Please subscribe to our channel and catch us for our next episode.